people. We are back again. Good morning, good afternoon, good evening. Take the goodness wherever you are. Hope we are enjoying our activities of the day. Today, we are back on Open Heart with Oluchi. My name is Oluchi Mekekwe. Today, we are talking about your health, our health in general. Stay back and see what we've got for you.
There's a concept in physiology. If you don't use it, you lose it. Okay. The only form of exercise your prostate gland gets is during erection, and that erection comes with sexual activity. Okay. So the study is abundantly clear that a man in healthy shape should be able to have sexual interaction 21 times a month. 21 times? A month, to avoid prostate issues, prostate cancer, or cardiovascular issues. If you don't exercise the gland, it swells on you. It becomes enlarged. When it becomes enlarged, that is a precursor to cancer. So yes, you have a beautiful wife. Do whatever it takes to please that woman so she can give it to you 21 times a month. Yeah. Don't quote me to your wife, Dr. Ken. So if she doesn't please you, I advocate to my patients that you can have a side chick. Your side chick could be on contract, but you just know that you need to do your 21 times to avoid prostate cancer.
I keep telling men that too much of everything is bad. And you know, as a man, if you ejaculate, it contains 400 million cells. So if a man just walk into a room with a lady right now, and then they have sexual intercourse, that man is bringing out 400 million cells. Yeah. Now, if the gland is overused, the possibility that it will cause prostate cancer is high. So, under normal circumstances... So
after doing it the first time, he can't go another round?
He can go another round, but what we are saying is that at least in a week, do twice in a week, it's okay. Don't kill yourself. Now, if we are looking at the 400 million cells, if we want to quantify it into volumes, you are bringing out 1 pint of blood. That's what you're bringing out as a man, yes.
Okay.
So, if a man goes into a room with a woman and brings out 1 pint of blood today, tomorrow you bring 1 pint of blood, the next day you bring 1 pint of blood, how would you survive?
Yeah.
You know, so this is something that men should really pay attention to. As you eat and do all the things you have to do as a man, one of the places that you should pay attention to is your prostate gland, because that makes you a man. You know, and you wouldn't want to have prostate enlargement where you have to insert a catheter before you can urinate. You know, you wouldn't want to go through the knife to go for a surgery and all that. So basically, prostate gland will occur when the cells over multiply. Sometimes some of the men who...
Today, our story is too many. We heard about what have been flying around about prostate cancer, what a doctor said in Nigeria, and a male doctor said in Nigeria, and what a female doctor said in Ghana. We have somebody to talk about it in a different way. Today, we have Mrs. Lillian Emetu, all the way from the US, a nurse practitioner. She is a mother. She is a philanthropist. She will give us, throw more lights so that people will not be misled in some things they had or have had. This is still Open Heart with Oluchi. We will now invite our guest, Mrs. Lillian Emetu. Can we know you more?
Hello. Hi, sis.
Hello.
How are you?
I'm good, and you?
Wow, amazing. What a good job you're doing. I've watched some of your clips, and you're doing a good job. You're helping all of us learn, because we all need to learn one or two things, right?
Exactly.
And the teachings and the enlightenment you bring with your you know, your time and talent and everything, it's really appreciated. So thank you. So what do we have? What do we have?
I want to know what is, because we had about prostate cancer, what the male side of it said and what the female side of it said. We want to know more about prostate cancer. Can you throw a little light about it?
Absolutely.
That will go into the other things.
Absolutely. Absolutely.
Yeah.
So first of all, we need to start with knowing what is the prostate as a gland. Okay. The prostate gland is the secondary male sex organ. Okay. And it
Yeah.
sits right behind the bladder. Okay. It sits right behind the bladder. That's why some men, if they start swelling, they start having urinary symptoms, what we call LUTs, lower urinary tract symptoms, because of the position. So the prostate has got two diseases that it deals with. It deals with just the swelling, which is the benign prostate hypertrophy, or the actual cancer, which is more of a disease of the organ that can be, managed well if found early, or it could be detrimental if neglected.
Yeah.
So that's that. Statistically, we know that prostate cancer is the second most common cancer in male worldwide, statistically. And then it's the number 5th most cancer death in male. So it's very important. And I guess the reason it has gotten much attention now is because we're seeing a lot of incidents where it's becoming complicated, as opposed to if one had found out early, it would have been kind of more of a controlled or managed. So it's gotten a lot of attention. I don't want to go into the science part, the pathophysiology, but what happened is when someone have, as male age, from the age of 45, some people 40, their prostate gland swells normally, but there's many things that can cause it to go out of order.
Yeah.
If we're dealing with only just the prostate swelling, it's treatable easily to relieve the urinary symptoms.
Yeah.
Now, if left untreated, it can cause cancer. So, but the thing is, the cause of prostate cancer, it's still very not clear. Scientists are still trying to put their finger as to what exactly causes prostate cancer. However, there has been some risk factors. There are some things that has been called to be risk, puts one at a very high risk of developing prostate cancer. And one of those is older age.
Yeah.
Race, Black race, has also been one of those that have this disease a little more than the usual, than other races. Genetic gene, family history. People that have their first degree relative tends to run in family, or gene. If you inherit certain gene, like males that have mothers or sisters that have a certain type of gene with breast cancer, they need to pay attention to their prostate. So there are some also not very clear risk factors as well. Like I told you, the scientists don't know exactly what causes it, but there are some high risk. But there is some also question about dieting, obesity, smoking, chemical exposure, sexually transmitted infection, and even vasectomy. All has also have not so much clear process of how they contribute to prostate cancer. So yeah, that's in a nutshell what prostate cancer is, or what can cause it, and how. And there are treatments depending on if it's just the swelling, which I call the BPH, benign prostate hypertrophy. If it's just the swelling, most people, they manage it with medication to help with the urinary symptoms. It's not a big deal. It doesn't stop anything. Some people end up having radical or partial prostatectomy. Some people have where they have just watch and wait, just monitor it and make sure that it doesn't go high. And then there's a way to assess, to find out. It's through simple physical exam. You can have DRE, digital rectal exam, where your general practitioner or primary care physician or primary care provider, which is what I do, digital rectal exam, or we check your prostate specific antigen. It's a blood test to check your level. If your level is a certain number, we get concerned and we'll have to call the consultant or the specialist, the urologist and the oncologist, depending on what we're dealing with. There's going to be more testing, MRI, biopsy. You have to have a prostate biopsy to have a definitive diagnosis. And based on that biopsy, we were able to, it has to be graded. The Gleason score comes to play. What is the grade? Because the grade of the prostate determines what kind of treatment. Do you just need surgery? Do you need the hormone treatment? Or do you need radiation? Or do you need chemotherapy? Or a combination of all of that? Or even immunotherapy? So there are different treatments available for prostate cancer.
Wow, I'm just knowing so many of these terms now. And I've heard about prostate, though. I've heard so many things about prostate, and I'm hearing it from a different angle now.
Awesome.
Thank you so much for throwing more light. I hope my audience, my viewers, our followers will see this and listen and know, watch themselves. But, sometimes, like you said, if it's not managed on time, it can get worse.
Yes.
I think it's all about every other sickness. When it's not found out on time, the thing can deteriorate and the person will not like what will come out of it.
Absolutely.
Early detection matters a lot.
Early detection, exactly. Yeah. And like they said, prevention is always better than cure.
Exactly.
And so if you're having any symptoms at a certain age, you should have at least once a year. Even if you're healthy, you should have once a year general practitioner, primary care physician to go check up. Just have a routine checkup.
Yeah.
All that money you used to buy clothes, stop buying the clothes. Go and use it to have a medical checkup.
Yeah.
If not anything, have the doctor said all your labs is well, good to go. You go your way for another year or two before you come back.
Yeah. Thank you so much.
Yes.
So, I want us to talk about the trending video about a doctor that went on Dr. Ken's program, and he was talking about sex and a man having sex for 21 days a month. I opened my eyes when I went 21 days. So the person don't get work again. You understand? The thing touched me. I was like, how on earth? And he talked about so many things that you have to have sex for 21 days a month. So how many days? That's an everyday thing. So it's now food. That is the cause of, if you don't do it, the person will have prostate cancer.
All right, I'm going to stop you right there. This is so sad. The word of God, because I'm a Christian, the word of God said that my people perish for lack of knowledge. It is very sad that a medical provider will say something like that. There is no correlationship between the number of sexual activity and the development of prostate cancer. It is a lie from the pit of hell.
Yeah.
He is wrong to the core. And I hope that the medical organization in Nigeria will call him to order. That is deceptive, very deceptive. There's no correlation. Yes, the prostate gland is a secondary sex organ, but the number of sex you have has nothing to do with the development of prostate cancer. That is absolutely lie. And the issue with the number of time couples have intimacy, it's really nobody's business. And for him to advocate having a side chick, that is detrimental to the family, to the wife, the children, the community, the society at large. Because what are you doing? You are advocating someone to have a side chick in an attempt to have this crazy, nonsensical idea. Yeah. when it comes to prostate cancer. So please, please, please be informed. There is no relationship between prostate cancer and the number of times a man had sex.
Oh.
It is all it's the scientists are not even clear what causes it. You heard me give you the details of what they have shed lights to and the ones that are still yet to be known. The risk factors and the possibility of race, family history of certain gene and older age can be what they're looking at. For this provider to come flat out and say that if you don't have sex 21 days out of the 30 days in a month, that you're going to develop cancer, prostate cancer, that is preposterous. It's wrong.
And
it's
we
wrong.
saw where we also saw where the Ghanaian doctor talked about limits. Everything should be on a limit.
So sad. So sad.
Because the two videos were contradicting. Then the other doctor said is about having sex all the time so that you run away from prostate cancer. But the other doctor, Dr. Christie, said that even too much of it, too much of sex can even cause you to have prostate cancer. I don't know.
It's not science. There's no scientific base to that. There is absolutely no scientific base. If she does, she can at least show us the research where it's done and proven that having too many. And you know, the number of times one has sex, it's really nobody's business but the couples that are involved. This is a covenant. Marriage is a covenant thing where the blessing of having intimacy is a blessing for the couple and should be enjoyed by the couple. If they did it once a day, once a month, it's nobody's business. There's no relationship between the development of prostate cancer and the amount of time you have sex. That's very deceptive. They're using their role and their position in a very wrong way.
Yeah, to put people to live immoral lives.
Immorality.
Because some people will listen to that and adapt it.
And it's sad because you're going to have some people that will listen to that and take it and run with it. And it's wrong. It's wrong. Being deceptive and misdirecting and, misusing their authority as practitioners when it comes to that. There's no relationship between the two. As a matter of fact, sometimes if we are monitoring someone that is, the prostate level is elevated, sometimes we will actually advise the patient to not avoid vigorous activities and sexual intercourse at 48 hours before we draw their prostate specific antigen level, before we take the blood test, because it can give a false rise, a false positive. So we don't want too much activity with the prostate gland through intercourse or vigorous exercise. So you will be told to withhold that a couple of days before we do your test, so we will know truly what your prostate level is. So to assert by these two providers that there is developing prostate cancer has everything to do with the amount of sex you're having. If that's the case, then there are some people I know that are wayward and they never had prostate cancer, and we know the truth. So it's not true. There's no truth to that. So I advise our young men that have heard these stories, please do not indulge in such things. It brings immorality, like you mentioned, in the society, and there's going to be a rise in sexually transmitted diseases when people go outside their marriage, and also it defiles the marriage. You know that marriage is a covenant, and when you do that, it defiles the marriage and bring about sin and death within that family. So it's definitely a no-no, and I hope that Ghanaian Medical Association and Nigerian Medical Association will be addressing those two individuals for being misleading. For being misleading.
Hey, this is another side of it, my people. Have you heard it? There is no link, no connection between living in sex, everyday sex, and prostate
cancer.
And prostate cancer.
No.
Don't be misled, though. Don't indulge in immorality because you had a doctor say that. Live your life the way you want it to be good before you and God.
Yeah.
And the Nigerian doctor went ahead to recommend contracting side chick.
Yeah.
I don't know. What is he promoting? What does he want to promote?
Yeah, that's sad.
It was so. I think it's not well cultured and it's unethical.
Yeah, very.
It's very wrong for a medical doctor. He did not even think about the what do they call it? Sexually transmitted diseases and other
the implications.
things.
Yes, the implications
of what he was saying on social media social media. No. That was so wrong of him. Anyway, that's that. We've had another version of it. Thank God. I wish people will watch this, listen to this, and live a good life.
Yeah.
Eat well, balance your food, eat very balanced food, maintain your weight, and well, our guests will still tell us what to do about our health. For men that are thinking of prostate cancer at some certain age, she'll still tell us what to do so that we'll not be misled by people's naughty opinions. This is still Open Heart with OLUCHI. We are talking with a nursing practitioner, Mrs. Lillian Emetu. Thank you for throwing more light on this. I have another question. This one is advising women. Can you tell our women, because the man was like saying if your wife is not ready.
Yeah.
Telling if my wife is not ready, can contract side chick. If she's not meeting up, I don't know what he means by meeting up. The woman will not kill herself. She will not kill herself because she wants to meet up to satisfy the man not to have a prostate cancer. It's so funny.
Yeah, it is. Well, so our role is really to encourage men. You and I know very well from history, a lot of men are very hesitant to seeking health, healthcare. They're very hesitant. They don't like to go. So our role as women is to encourage our spouses to go for medical checkup. Now, anybody that has the first-degree relative that had prostate cancer needs to be screened early. As a matter of fact, I know you from state, American Cancer Society in 2023 recommend that anyone with that first-degree relative need to start the screening as early as age 40.
Yeah,
okay. So start age 40 to talk about it and monitor yourself, like you rightfully said, manage your weight better. Just have a routine physical. I know we like to spend a lot of money on clothes, cars, and stuff. Our health is also important because you have to be healthy to wear those things anyway.
Exactly.
So so the thing with the women is to encourage our spouses to go to the physician and get their physical checks and blood tests. And also the issue with the side chick is kind of almost comical. It's just if someone want to cheat or commit adultery, I mean, they've got the reason to. If that's something they want to do, it's still wrong.
Yeah, not
institution of marriage.
Prostate cancer.
To cancer. No, it has nothing to do with prostate cancer. It will bring havoc. In fact, we had a case where a man stepped outside his matrimonial home just one time, contracted a deadly sexually transmitted disease, came into the house, gave it to the wife. And it's been very sad for the entire family. So it brings nothing, there's nothing good that comes from that other than pain and just agony. But institution of marriage is a sacred institution and must be honored for what it is. The intimacy is between the man and the woman, and it should be their decision what they do with their time of intercourse, where they please one another and not just one-sided. It's for both. The pleasure that comes from sexual intimacy is for the woman. As much as the woman want to please the man will also strive to also please her. Yeah. So yeah, we have work to do to encourage our males to, and of course, prepare some nice, healthier meals than we normally do. Yeah. So
like what?
There are people that are caught up. So what? For me, the rule is after age 40, you can't eat like you used to. That's one of the things I have with my patients and the people around me. After you age 40, for me, I say your grace period of eating nonsense is over. There is no need for you to sit down and eat so much heavy set of meal, but there's no activity. So if you have access, I know not everybody has access, but if you have access to fresh fruits, vegetables, very advocating to do that. But amongst all, even if you eat anything, exercise, it's been proven that exercise is yet one of the best things you can do for your body. So you can burn off all those energies and, and the calories and the carbs, whatever the case is. So we need
it must not be. I do tell people it must not be a rigorous one. You can do light exercise.
Daily walk. If you can walk at least three times a week, 3 times a week walk is excellent way to keep the body healthy, cardiovascular health and overall health, and keep the weight down. So and then some people will say, well, I try everything, I can't lose weight. Well, maybe you need to go see your general practitioner so that your thyroid will be checked as well. Because sometimes if your thyroid is out of order, it can cause you not to lose weight. Because so definitely there's what we eat matters. And the sugary drink, artificial drink needs to be cut down. When you hit 40, I mean, you can do all that in your 20s and 30s and get away with, but when you hit 40, there's a lot needs to be changed. A lot needs to be changed. Yeah.
Our diet.
Yes.
I hope we've all heard this is the thing we want to hear. Not that we just want to hear it. We need to practice it. We don't need to, I've always tell people, you don't need to listen to what people want to say to trend. Because I believe some people want to say things to trend so that they will be trending on the social media. Yeah, they will not say the truth. They will just say what people want to hear so that they will be trending. We've heard it from the another side, and we've heard from the another side of it that it's not about sex. Prostate cancer is not about sex.
No,
it's about a healthy living. A healthy living, and for somebody, a human being that is sane, to come out and talk about 21 days a week sex and advocate for side chick.
Right. Yeah, that's sick. That's very deceptive. That's very deceptive. Yeah.
And people some men are like, oh, have you heard it? Have you heard that one? Is now this one? No. Yeah. You as a man, can you have intimacy for 21 days a week? What are you doing?
They don't have a job. They don't have a job. That is
do something about that man. The medical Institute of Nigeria should withdraw that man license.
They need to. Somebody needs to call his attention to order.
Trash.
Yeah.
He talked absolute trash. And the some men that want to be wayward will just dive into and do what they want to do. Exactly. Like you advise us women to tell our spouses, our brothers, our relations to keep track on time. Check your prostate gland from age 40, especially when you have history of cancer in your family. And when you're age 40 is very, very vital to start checking. Because early detection about in any sickness.
Any sickness it
is, whatever sickness it is, early detection is very, very vital because it helps you to manage the sickness than
absolutely
at the late hour. When you find out at the late hour, it might not be easy for the person again.
Yes, it's tough. It's definitely very tough because complication sets in. It's a lot of emotional trauma when that happens. So definitely early is the way to go. Yeah. And you know, like we were talking earlier, because there is no definitive cause, but what happens with the prostate is that the DNA becomes abnormal, and the scientist doesn't know what causes the DNA of the prostate to change and become abnormal, but they have given us relatively what we call the high risk. And so from that high risk, any male, brothers, uncle, we need to encourage them to go and have that once a year physical and paying attention to that. Like women, we pay attention to our breast. It's similar for the male as well when it comes to their prostate, where we have mammogram and self breast exam and stuff like that.
Yeah. Oh, thank you so much.
Yeah, it's my pleasure.
Hello, my people. I hope people have heard it from the horse's mouth. Not be me talk more. This one not be say I want trend. This is the core thing, what she knows. And if you read deep into it, you will find out that this is true. Nothing like deception in it. It is facts from the horse's mouth. It's not me that said it. So don't listen to that jargons that man said. Don't listen to anybody that will tell you that you will die having sex because you want to protect your prostate gland. No. You heard it from man. It is not done like that. Thank you. We are happy to have you today.
It's my pleasure. It's my pleasure.
Again, maybe we'll talk about another thing. You lecture, talk about one other thing about ladies.
Yeah, I know time was an issue with my side and your side, but I think we can try to do that again.
Yeah. Maybe we'll talk on a different thing about. Okay. We are done with this one now.
Okay.
Thank you so much. We appreciate.
Thank you for having me. Love you guys.
You. All right.
Bye-bye.
Thank you. Let me round up. Hello, people. I hope we've all listened to her. For some of you that are shouting, side chicken, having sex for 21 days, you won't die for the sex. You won't die. No, answer me. So you don't have any other thing to do. That your wife don't have any other thing to do. Even that side chick that you want to have, you don't have any other thing to do. No, let's think. When we're listening to some things, we have to use our number 6. Not everything you start arguing or you dive into it and start practicing it. No, you've heard it that sex or anything sex does not have any link to prostate gland. It can be hereditary. Anyway, there's no point in talking. You've heard it. Listen to what she said. Practice it, and you will live long. You will be better. Tell your husband, tell your brother, tell your uncle, tell any male around you that is up to 40 to always check his prostate gland. Go for round yearly routine checkup all the time. Know the state of your health. Today, we talked to the nursing practitioner in the US, and she said so many things about this. This way, if you tell your husband, your uncle, your brothers, this is what Open Heart with OLUCHI is all about. Help others to live, help others to grow in whatever they are doing. Because when somebody is sick, that person will not do much. The person will be a liability. The person will be a liability to you that is taking care of the person, be it a man or a woman. Be a light to somebody. Tell them, because men, I must tell you the truth, men, they want to be forced, they want to be pushed push them to do what is supposed to do, not what the other doctor said. Push them to go for tests. This is still Open Heart with OLUCHI. Thank you guys for the subscription. Keep watching. Subscribe to Nwafo. Share, like, follow us on Twitter, on TikTok, Nwafo TV, on TikTok, on Facebook. Follow us on Instagram. Subscribe to Nwafo. Listen, watch our programs on Open Heart with OLUCHI. Thank you guys. See you next time. Bye.